I'm Dr. Bernous, though many people know me simply as Dr. B or Dr. Beebe. My guest today, Dr. Hessam Motamedian, is a clinical psychologist, psychedelic-assisted therapist, musician, and mental health philanthropist whose work bridges depth psychology with integrative approaches such as interpersonal psychology and internal family systems. His approach centers on the belief that many emotional struggles stem from an absence of self-love that disrupts one's relationship with self and others. His work focuses on cultivating self-compassion and helping individuals access and navigate expanded states of consciousness as pathways to healing and spiritual transformation. Beyond the therapy room, he designs experiential workshops and ceremonies that weave psychology, music, art, and plant medicine to foster personal and communal healing. Dr. Hessam is the founder of Therapy for Iran, a nonprofit initiative that provided free counseling to underserved Farsi-speaking communities worldwide. Though the organization ultimately had to dissolve due to political pressures, its mission continues to inform his commitment to making healing accessible across cultures and communities. Welcome to Astana.
Good to be here.
Well, we've been together for a long time, but we never got this opportunity to sit together and record this.
Many reasons, right, over time, but good to be here. Yeah,
absolutely.
Excited.
Today is the day.
Today is the day, finally.
Absolutely. So, Dr. Hessam, what would you like to start talking about?
We talked about psychedelic-assisted psychotherapy. You were interested in ketamine. We talked about that. I guess because it's being a nuanced and less talked about topic, that's a good favorite of mine. We can go there.
Sure.
But I'm open to any curiosity that you might have within me and within yourself in this sitting to go whenever we want.
Sure. So should we start with ketamine-assisted therapy a little bit?
Yeah, definitely. So there is, as you know, psychedelic-assisted psychotherapy, and it's a general term. We need to define it even further, but basically mixing up any psychedelic medicine, whether it's classic psychedelics or synthetic ones, in conjunction with psychotherapy. So it's the mixture of both that creates the maximal effect. The medicine itself has certain neuropharmacological qualities that create certain psychic states, and psychotherapy gets to take advantage of that opportunity for a few hours. There's this more expanded state and more capacity for outside box thinking, analyzing, rehearsing.
So you see the difference because you do have regular therapy and you do conduct ketamine-assisted therapy.
Yes.
So when you talk about these states of consciousness, how do you see it being different with someone who's under the influence and someone who's not? How does the session look different?
Well, you can see this in few ways. That's a great question. One is I definitely see a lowering of what we refer to as psychological defenses. There's this reduction in defensiveness in general. You see that definitely, both behaviorally, the client posture looks different, maybe, or they're breathing with more ease. So that's one category. And behaviorally, or the content of what they share can be more intimate, could be more deeper seated memories emerge. But there's more compassion, there's more self-acceptance and sort of like an openness to what's being revealed to self. Whereas maybe in a non-ordinary state, a person is more guarded of their inner content.
So there is less resistance, more openness,
yes,
you feel like.
Yes.
And more maybe of the unconscious is being presented in the session, right?
If you by unconscious, you mean memories?
Repressed memories.
Repressment, definitely.
Right.
More access to that. And I think the third component is also very important. So one being compassion. One being there's this courage and fearlessness. So the fear response in the nervous system goes down. Right? And our ability to see what was previously frowned upon, shamed, felt with anguish or pain, it kind of presents itself softer and more acceptable. So there's compassion, there's less fear, and there is more access to memories or unconscious material. And the combination of these three changes within the brain and nervous system.
And you take advantage of all of this together as someone who's there with the client, right? And then you utilize this openness of the person to experience and hear and maybe review some parts of self that was frowned upon, as you said. And then the sessions are usually longer, right? The ketamine
longer than
assisted-
usual. 2 to 3 hours is what we are seeing a standard in the industry. But it's because only, again, ketamine as a medicine is widely available as an off-label prescription for antidepressant. But other than that, other medicines, at least in California, they're not still legal. So we have psilocybin being practiced in places like Colorado or Oregon, and other countries, other states.
How are the qualities are different? Because the trips are different. I mean, psilocybin trip is different than a ketamine trip.
Certainly.
How do you see that being different in the field of psychotherapy? I mean, have you worked with someone that was tripping on psilocybin?
No, I haven't. Yeah. So there are two categories of practitioners. It's a good question you're bringing up because it makes me think of a big community out there of brothers and sisters doing good medicine therapy work who are not licensed. So I just want to go on record to say that psychotherapists in general are new to the field, past several decades. But there has been an indigenous form as well as more ancestral form of doing this kind of work that has passed down from many generations ago. But aside from that, the experience itself, yes, you're right, is very different when you're talking about MDMA or psilocybin or other classic psychedelics. You are talking about a wide range of different aspects of psyche representing themselves. But there are some underlying overlap areas that you see, and a psychotherapist takes advantage of those shared qualities. Three of which I already shared: the increase in compassion, the decrease in fear response of the nervous system, and in general more accessibility to previously protected memories. And so those are I would say, the overlap between different medicines. But how ayahuasca creates that experience with that lucid, candid, sometimes even harsh language on the journeyer is very different from the mothering, very nurturing qualities of psilocybin, and from more spatial, detached from body in ketamine. So the formation of the experience definitely
They're different.
changes. Absolutely.
Right? And as you mentioned, like mostly psilocybin, it gets you connected to the earth, to the ground, to the nature. Ketamine gets you a little bit more into the space. But then at the same time, it seems like that when ketamine is being used, it allows to bring up some repressed memories compared to psilocybin. Because psilocybin gets you into this, my understanding, my experience has been psilocybin gets you more into being one with everything, being one with nature, and this wholeness, while ketamine is allowing you to not only go into the space, but also go deep into the repressed parts of the psyche. So do you use it regularly, ketamine assisted, and do you see it being beneficial?
I'm going to come to the second question next, but just about that medicinal information that you provided, we got to also realize that there are people who are heavy experiencers and they have done themselves as providers of this kind of work. They also have undergone that form of treatment. I haven't gone through ketamine-assisted therapy myself, and there are many other practitioners who haven't experienced it. So I rather commenting on the kind of experience one experiences, like connection to Mother Earth or having outer space experiences. Myself is more limited, so I'd rather not comment on that. However, what I can comment on is the shared experience among users, and that has been registered, and because it's scientifically tracked and there's evidence that I can refer that to.
Speaking of therapy, you also provide different kinds of therapy for trauma, right? Internal family system. You utilize different modalities.
Yes.
Do you have any preferred modality that you use, or is it based on your client?
The internal family systems would be my modality of choice. And going back to the other question, ketamine-assisted therapy is maybe about 10% of my practice. I'd like to work with selective others. But psychotherapy itself without medicine, I think there is something sacred about that. I'm glad that you're bringing the concept of the conversation there. I think psychotherapy itself is underrated. And there is an overrated attachment to psychedelic therapy right now in many communities. And I want to also mention one thing before we move on from the topic, that psychedelic states are not always just limited to the consumption of psychedelic medicine. We have non-ordinary states that we can access through breath work, drumming, certain circles and practices. I'm fascinated by those. Because if you can go there without the impact of a medicine, then you can use less medicine, and that's beneficial. Always less is more, in my view. But also you get to have this confidence that I went there myself. I created that experience myself. I danced for a half hour and I created this particular mental state for myself as a result. As opposed to, and again, I don't have any problem with drugs. I think drugs are awesome. We all are consuming drugs. This tea is a drug. But to go beyond that and consider it as a specialized tool, an ancient one, that we can carefully hold with sacredness in our hands and hearts and use when we absolutely want and need, and we really are intentional about it. Something that I'm concerned about is the harmful aspects of medicinal use in recreational and clinical settings, and how we can reduce that in terms of harm reduction.
And I'm sure there are certain criteria you consider that if a person is a good candidate or not for, the use of psychedelic assisted.
Yes, I psychologically only. I see the preparation and the motivation of the person and intention. All the medical stuff needs to be handled by physicians, because they are the ones who are assuming the liability. So that's one nice thing about the new forms of businesses that are growing around ketamine therapy, is that they are the providers, so they just do the assessment and screening and they assume all the liability. So a therapist, a provider, just focuses on what we do best. And I really love that. It's good to know that. But having said that, certain people with certain conditions, like it could be medical issues, and if they're undergoing some form of treatment that is
How about
active.
if they're predisposed to maybe some, psychotic features?
Definitely.
Is there something to consider?
For sure, absolutely. All need to be considered. So it's a very multifaceted form of assessment, a psychobiological, but also very social aspect, and also a spiritual. What's the tendency of that person's desire to go in this kind of treatment, all of that. But the medical aspects, mainly cardiovascular conditions, so because it increases the heart rate. So, and I like to think that any psychedelic practice, even holotropic breath work, which you and I have talked about before, by Stan Grof, right? Something like that, it changes the physiology. So it's not as safe for everyone. We gotta sort of like assess person's readiness to go there, and it takes physical stamina to go into these states. So yeah, I'm really conservative when it comes to that.
I'm glad to hear that, because for you, someone as a professional who practiced this, and you're promoting this sense of safety and consideration of each individual, it's really important, because as you mentioned it very correctly, that maybe sometimes people look for some like solution for all. They try to promote everything. Maybe it's so important to consider the need for medical check, psychological checkup, and make sure the person is a good candidate or not.
Yeah, absolutely.
And you also mentioned that maybe the regular therapy is not getting the enough attention these days, that they think that the only good approach is if you are under influence of some substance for therapy to work, which is not the case. You and I know that regular therapy also is very effective.
You are talking about preparation. And that conversation all goes into that preparation phase of the work. And some people think that, and unfortunately amongst my colleagues, think like, okay, it's the day, it's the dosing day. But to me, it's like all the days that have come before that, addressing all the concerns of a client, assessing their motivation, their fears about not wanting to do the work yet, but being curious about it. Being scared about getting stuck into dark places and recesses of the psyche and not being able to come out, or losing my control over mind and letting go of the control that I have in daily life. And maybe something comes out of me that could be packed with shame and somebody sees it, or my provider sees it, or if I'm doing it in a group, the group sees it, like ceremonially speaking. And all of those layers of unconscious, they start coming through. So we do a lot of preparation work, and not everyone is a good candidate right now. I don't want to say ever, or maybe the person needs to work on certain things to make themselves ready for that kind of self-observation practice, even if it's for a few hours. And then we have integration, of course. So then after dosing comes, what do we get out of our experience, and how do we turn it into daily changes?
You do include that in the same session, right?
No, definitely
the integration not in the same session, it's the following session you do before
absolutely
starting a new.
So for ketamine-assisted psychotherapy, there are usually at least 2 preparation sessions.
Okay.
And then we have the dosing session, and then we have 2 to 3, at least 1 integration session, and then we have another dosing session, and then then after the dosing session, the integration will be the preparation for the next one. So it kind of becomes seamless, and then there is this loops of preparation, dosing session, integration sessions.
So these are like regular sessions, like a week apart we're talking about?
It depends on their treatment plan, to be honest. I'm not so rigid on that. If someone needs, there's a rule of thumb for sure. We don't want the integration to happen more than 72 hours, because that's the neuroplastic
After or
window.
Before?
After.
That was my question.
Yes.
That is, there is a window, right?
Hmm.
That's the person is so receptive to the new insight.
For sure. And you want to be available during that time, sometime soon. For them to make a better sense of, for them, I mean clients, to make a better sense of their psychedelic experience, and be able to then look at their intention and see how the new finding about themselves can help what they intended upon become a reality in their life, and how to be an integral part of their life moving forward. It has its own artistry, and there are many variables that we need to look at in order to ensure good integration. And sometimes it's not successful. I'm not saying we have an awesome success rate, but psychedelic-assisted therapy is quite successful in addressing what conventional psychotherapy sometimes fails to do. And we only see some success with deeper ground-up approaches in psychotherapy, more somatic, body-focused therapies, and implicit memory emotional expression that then we don't see in talk therapy, right?
But there is one concern here I have. As you know, I'm very into psychodynamic, and the rule of thumb is we don't push when there is resistance. And you know, Freud himself first started with hypnotherapy, but then abandoned it because he said, I don't want to expose someone, psyche, to something that the person is not ready to integrate. That's why he was not trying to break the defense mechanism. But what we talk about is someone under influence of psychedelics, the defense mechanisms are a lot more malleable. So more information is coming up that maybe as under usual circumstances, right? So have you ever had any situation that, or the question is, is it safe to consider this person right now is malleable because is under influence, but would this person be able to still integrate this when the defense mechanisms are back to the normal state? That's my question.
Yeah.
Have you ever had any experience the person was open when they were tripping or under influence, but then after down the road, a week or two, they're going back to the normal?
All the time.
Yeah.
All the time. It's part of the returning of that ego structure that temporarily was put to sleep in terms of ketamine use, or maybe it was on the sidelines observing what happens in a psilocybin journey, and the person has more of a self-observatory realization, whereas in the ketamine there's more of a loss of ego and a dissolution of sense of self. So yeah, but I don't want to get into that rabbit hole. Going back to your question, it all depends on many factors. Like one is, like I'm myself particularly interested in not removing the defenses, because then they come back sometimes with a backlash. That because they're not, especially if we harry the preparation phase, some of these ego protectors, they come back pissed off. Like, what did you do over the weekend? Like, you pushed me aside and you did that thing, and I had not given permission to that. So it comes back, and it's okay for it to come back. It's part of the anxiety reduction education to tell clients not to have large, unrealistic expectations, because the ego needs to come back. We need our ego. Ego is a good, helpful quality. But hopefully our relationship with it starts changing through this kind of work, and not just psychedelic work, of course. So yeah, it happens all the time. But then integration purpose is to hope for being able to dance with all those neuroplastic components and facilitators that create optimization in the person's life with astute knowledge and careful assessment and conversation and communication with the patient, and identifying all the other history that you have from that client up until that point, and how long, especially the work can look very different from with someone that you have worked in psychotherapy for a long time, you have established that rapport. Then if I get a referral to do a ketamine-assisted therapy for somebody who has her own or their own therapist outside.
Oh, so they could come to you only for ketamine-assisted while they're going to their own therapist?
Absolutely. Yeah. It's actually a more interesting type of work, because I get to isolate the impact of CAP, but with the other format, I cannot isolate that effect.
What do you mean you can isolate? I'm not sure.
Well, all the confounding variables, I can account for them, because I know now the only impact that I had on this person was the several sessions they came for a CAP treatment. CAP being ketamine-assisted psychotherapy. And otherwise, I don't have ongoing influence on their psyche. But they do get that influence from their own psychotherapist.
But don't you think what you and that client achieved through that process is going to be a big part of the personality? Because you helped the person, something new came up to the conscious level. It's like that, it's out there now. They can't just, put it back. So I'm sure then that would be presented in their usual treatment as well, right?
Absolutely. Hopefully there is this possibility for the therapists, the regular ongoing therapist and the CAP therapist, be in some form of communication. That would enhance the clinical outcome.
But you also do it for some of your own clients too, right?
Yes.
That they are your regular therapy clients. They might have like ketamine assisted for a while and then go back to the...
Yeah, in a fairly easy way. There are these forms that it takes few minutes to fill out that measure anxiety and depression, and they're widely available online, I assume, too. So those are very simple pre-post type of measurements that we can take. But I prefer not to take them right away. One, because there's this increase in hope and expansion and connectedness right after sessions. And then, as you mentioned earlier, the defenses start coming in. so more contraction and less compassion become available, and that's possible. There is a drop, right? It has been like an engine on a turbo, and then now it's like right. So it has to slow down and touch down, and rest and sleep are super important. The best quality integration happens while we are sleeping, and we do it every night.
And what I was interested in is that apparently the duration of the effect of the edible ones, like lozenges, is more in ketamine than the ones that esketamine, that they spray, the nasal.
I haven't worked with esketamine yet as a CAP therapist, because partly it's only Medicare approved, FDA approved.
Is the esketamine.
Yes. And so the kind of ketamine that we use, the lozenges, are off-label.
But it seems that they last longer, because I have had the opportunity of working with a client with the nasal spray, and it really was only lasting about 45 minutes.
I would believe you.
To be honest with you, we timed it. After 40 minutes, the person was completely back. But it seems that lozenges are lasting longer.
I believe you, not because what you said is entirely right, but because every body is different, and maybe that person's unique profile made that medicine not be so fast acting and influential as it could be on someone else's body. So from that perspective, but for sure you got a point here. So I'm not sure, to be honest, but lozenges have this effect of needing to be 10 to 12 minutes under the tongue or being swished in the mouth. And there's a lot of absorption that is happening gradually.
Yeah.
But the sprays are very fast acting, and they just go through the central nervous system with as little barriers as possible, and they have the sudden big impact. I kind of don't like that. I don't know. I haven't tried one.
But I've done is also some research and seen that is the case. I've seen again a couple of clients with esketamine that really was as soon as they used the spray, within 5 minutes it kicked in. After 45 minutes, it was gone. And I've seen it in 2-3 different people.
And here's the thing, 45 minutes, an hour, that's great. It's a very fast-acting, short-lasting medicine. And that's one of the beauties of this medicine. When it came around, it was during the war. And so amputations were there. And they needed to make the pain go away. And ketamine was an anesthetic that was also packed with pain-reducing qualities in different streams of neurology. And so it was very effective. So things of that quality, there was this rescue mission in Thailand that 12 boys with their soccer coach were stuck in a flooded cave. And that's several years ago. And it included 10,000 people, something around that, to do that. One of the most prolific rescue missions ever recorded, apparently. And what was interesting, they gave ketamine.
To who?
To the boys, everyone, to go through that experience and being rescued and the pain that they must have endured.
Oh, after when they were rescued?
While being rescued.
While being rescued? Yes. Oh, interesting. Yes. There are a lot more than ketamine therapy that you do. I mean, you're a great musician. Would you mind talking a little bit about your passion for music and art?
Coming from a great musician yourself, I don't want to say great. What is great? With music, what I like about any kind of creative expression is it's because it's so technically available, because I'm not so talented in music in a technical way. And I always wish that I was. But in the creative process, there is, in the right brain stuff, there's more expression benefits than I think an engineer would feel creating a masterpiece, with all the respect for the artistry that goes into that architecture. But for sure, what I think that through music, the expression becomes free, and that's why I love it. And I think music is great to me, as opposed to me being great to music. But
you're very good at expressing. Let me explain it. You're very good at expressing your feelings through music. It's not about the mechanical and mastery over the physical aspects of the technique. But what I'm what I mean is that you're really good at expressing your feelings. The way you play your instrument is very inspiring. That I can attest to. That is very inspiring. And it seems that whenever you play your music, I've observed, it just becomes part of you and you connect to your music. So do you find it helpful in your line of work as well?
It's a magical state to be in. I'm blessed with that. Music has been very therapeutic for me. It's been very dear and close to me, and expression itself. I do. I find it very close, and I want to bring more music in my work. And when I do bring it, I try to incorporate it either ceremonially or my attempt is to invoke certain emotional states through lyrics, through intonations, and through melody. You create lasting impact that other forms of talk never get to do. And so I love music because it has its own universal language and it bonds people. But yeah, I don't want to get into that rabbit hole too whole. But therapeutic music in general is very interesting. For the difference between that and music therapy. As you know, music therapy, you need to have its own specialized training, and you can't call yourself a music therapist unless you have its certificate. But aside from that, therapeutic music is just looking at music. It's just a universal phenomenon that has lasted forever as a language form that connects and resonates and deep within each human being creates lasting changes. And from that perspective, it needs not to be facilitated only by a therapist who is certified in it. So then as a therapeutic music provider or as a film-informed provider or as a photography-informed provider, you're getting to go into the integration space in psychotherapy, and you can bring in different disciplines. A client of mine integrates boxing with psychotherapy. He's a boxer. Right? So we have all these possibilities, and music is one of them. And
how does he do boxing with therapy?
I don't ask.
Because I think it's very important.
Karate, all different forms of martial arts are well integrated.
So they feel good when they kick the. I'm just joking.
Nah, I love martial arts. I'm not a martial artist, but I adore it. The thing is that it's part of conscious practices, consciousness practices or conscious practices like yoga, tai chi, all of them. They incorporate body, and the nervous system is a spread through the whole body. It's not just located in our mind. And when we access the potentials of our nervous system through embodied movement, we are incorporating parts of our nervous system that you and I don't incorporate right now. They're idle because we're just sitting and talking. But there is the whole section.
Should we stop this, start walking around maybe?
It will create a different experience.
I wish the camera could follow us,
Imagine that. That would be a unique form of podcast.
Exactly. Maybe we should work on that. We will ask our producer to
creativity. See, we are talking about music and expression, and we are already outside the bounds of logic. That's what I love about it. When you bring that form of modulation of one's internal psyche to action, it's so enjoyable to watch as a provider.
And speaking of, speaking of movement and motion, I know that you also have been experimenting in other fields of art as well, including theater. Right?
Have I? Yeah, psychodrama. Yeah, I love acting, and comedy is a big part of my life. I have to make others laugh and make myself laugh all the time, every day. And acting and learning to understand what the actor does that makes him so appealing in every way is a very interesting self-study. I've only done it for a year and a half, max 2 years.
You're talking about
studying acting and the different forms that are embedded in it. A couple of major schools of acting. And so then there's this intersection between acting and drama and psychotherapy. You're
Yeah.
familiar with psychodrama.
Yeah.
And the aim of it is to maybe dramatize human emotions and make them more accessible.
Yeah.
And the behaviors that go into that, and happens usually in the group setting where different people become different characters of your life.
Yeah,
If you are the center of that group practice. And the dance that takes place there is so magical, it's so interesting. That might take, again, long time to reveal, let's say, in a standard family systems therapy.
Psychodrama is very interesting. I remember in school when we were in grad school and we're practicing it in class, the way you said you externalize it. So somebody was directing us as representations of her own feelings or different people in her life and was directing us. And then each one of us were also experiencing it and we would add to it. And then she was saying that it's very interesting when you guys also add your own take on this. It would help me to not only externalize my feelings and people in my life, but then also having this experience was very fascinating, the psychodrama. But it was only for me, was only limited to our school. I never got the opportunity of practicing it outside of school.
It makes two of us. I don't practice it either. I want to. Maybe I consider it for the next continued education.
Maybe. I think if you found one, let me know. I think it's very interesting aspect that maybe should be utilized more. Why not?
Why not? Yeah. So the menu is endless, right? That's the conclusion. There's so many human activities that one can call therapeutic, can't we?
Yeah, but don't you think, Doc, that this is actually one of the problems of our time is that there are too many options. And maybe sometimes people get lost in which one do I want? It's more like sometimes I use the example of you go to a buffet and you want to eat this, you want to eat that, should I eat this, should I eat that? And then maybe you try a little bit of each one and you feel like you don't have any more room, but you also don't get the feeling that I ate something fulfilling. Versus when you go to a restaurant and you choose one, item and you eat that, you feel like, okay, I had this. But I feel like that our options, our choices, maybe is getting in the way of fulfilling our needs for integration of the experience. I don't know if I'm making sense.
You know what I want to say? What does that make you feel? Do you feel that helplessness?
No, what I see is that what people are dealing with. At a lot
So
of
it's pain that you observe.
I see confusion.
Confusion, some form of psychic pain.
Confusion and lack of dedication to one thing. I see the lack of mastery.
Now, what do you think the problem is?
The problem is too many options.
Too many options.
Yeah, and
But
that
could
takes
be
away. It takes away from dedication to one thing. For example, you and I both play guitar, right? In my time, actually, which was a long time ago, you had to dedicate, and in order to master an instrument, you choose one instrument as your main instrument, right? And that's the same when you go to any school for music school. You choose one instrument as your main, and then you might play others. The reason is it takes ages to master something. But then with the help of technology and too many choices, people are doing so many things without mastery over even
100%,
one thing.
100%.
Don't you think that is
Absolutely.
happening?
It is happening. So partly the problem is what you're pointing out, the variability. And we are pleasure seekers, essentially. We want diversity. And so we got a longer menu. We are curious to finish the menu at least once, right? But then there is another side to the same coin, and that is the pleasure that comes from not committing is so common these days, isn't it? Commitment is painful. You have to sacrifice. You have to say goodbye. You have to let go of many, many different forms of attachment that we all have, and stay with a track, and really make your instrument your beloved friend who you spend a long time. Like, how many hours did you, or were you told that you need to practice?
8 hours.
There you go.
Yeah.
Right, that's what it takes, and then multiply by many days
Many days and many
at
years.
least 10,000 hours.
Yeah.
Is
But
what
that's very interesting what you said. I love that commitment is painful. And I guess we are avoiding pain. And I see in our modern life, we want everything convenient, painless, readily available. So maybe that's why people have hard time committing.
It was that book, The Dopamine Nation, I think, that explains it very well. Yeah, we are. That's our ailment. It's on a collective level. And but I'm an optimist. I think we are headed in the right direction. I think this is meant to happen. What's happening right now is really meaningful.
But where is it taking us, though? I know we are maybe letting go of certain things, right? It's an evolution in a sense. I am with you. I have nothing against technology. But I believe that, in my own opinion, I believe that maybe technology has evolved too quickly.
100%.
And our brains are, psyche doesn't evolve like that quickly. And maybe it got so fast, the pace, the options, the changes are so much that people are playing a game of trying to catch up.
And I have one hope for that. I think you're right. My hope is that human consciousness on a collective level is gonna somehow, I'm gonna tell you what my theory is, catch up with that technological advancement. So much so that we are gonna, consciousness-wise, we are gonna far exceed available technology. I'll take that in for a moment. So here's where I'm coming from. I think human consciousness for longest of times has been so aching and in pain on a collective level. Look at the wars, look at many things that have always gone on in spite of technological advancements, right? We haven't figured out certain basic communal rules across our planet. We are still very barbaric and very selfish in our approaches to problem solving. Countries, at least countries. But humans are different. We are evolving as a species. Our consciousness is syncing up very rapidly. Human consciousness and awareness is rising. Darkness is rising for sure. There's no doubt about that. But human awareness of our limitations, our capacities, who's at fault, whatever, that is spreading very rapidly. And I think once we pass that threshold, then we leap into a new plane of collective connectivity that impacts each individual underneath that network of consciousness. And once that happens, then we become artificial intelligence, but in a sense, but we are still humans. So that's why I'm an optimist. I don't believe that AI will take over us.
So we become like a hybrid species?
Here's what worries.
Because you know what they're talking about. I was watching, Elon Musk was saying soon we're going to, create this people who have been blind to be able to see with the implants they are working, which it sounds fantastic. Right? Yeah. So it sounds more like those movies we've seen that it's like we become hybrid, that we implant different chips into our brain. There's going to be no more, learning disorder. Memory is going to be advanced. So we're gradually shifting. I hear you. But at the same time, I am very cautiously maybe optimistic, but I'm also seeing the problem of our era, which is, look at the, younger individuals, that they are more and more into, when I ask the youngsters, when we do like therapy, intake testing, that, do you have friends? Oh, yeah. Do you guys hang out? What do you mean? I mean, do you guys go out together? No, not anymore. So what do we spend time together? What do you do? Oh, we play computer games from our houses together. So I know the nature of hanging out is different than the way that it was for us, that would physically get together. That's why you and I, and with the others, we try to have Astane and have workshops and things that physically we get together. But don't you see that there is becoming more like there is a distance growing between physical connection between people?
Yes, but that's temporary.
You feel that?
On two levels. One is that there's so many communities around this country, other countries, that they are holding the tribe. They are they're buying these lands and creating infrastructure on it, limited enough to sustain living. and keeping things simple. And that way they are maintaining our authentic presence on this planet, right? So that we have that group of people and it's growing. I love positive news. So that's one positive news. The other positive news is that it's temporary because it will reach a point where we are convinced that going back to the simple way of living is the answer if we are to survive as a species. And more technological advancement needs to be preserved for unique tasks. And like, yeah, for sure, change my liver and give me a new one. I'll be happy. When I need to go in that path, I'll sign up for Elon Musk or whoever is offering. But I don't want that to be a central part of human life. I'd rather harvest potatoes on a land and go dip my toes in a river by. And that brings more healing for humanity.
Don't you think this movement towards going back is a movement to correct and maybe bring balance into the picture, because technology has been pulling us too far to the one side?
Absolutely.
And that's why we are interested in slowing down, to go back into touching, being together, physical connection, right?
So I think based on that, I think there are two approaches. One is to worry about this process, really, and say, well, look where we are headed, all these negative stuff happening. That causes anxiety and worry. And I think that's part of the Matrix's intention. But the other perspective is to let go of all of that and be optimistic about the outcome. We are going to find our way, even if it's by years of confusion and being lost. And I think that teenager who plays that video game that you referred to, he or she's going to struggle at some point because of the lack of earlier learning, of learning to socialize, be in community, have friends. They're going to suffer, but then they're going to learn because they're smart too. And they can learn that, okay, so I can't just stretch my legs in front of my grandpa and expect him to respect me back. I gotta sit appropriately. So those things come with some painful experiences, but they learn and correct themselves. But that's where parenting is important.
Yeah, but see, I maybe disagree a little bit. I don't see this as worrying. I see this as being prepared. I'm not worried, but then I'm concerned. The reason is, if you listen, I'm concerned.
Absolutely.
Maybe it's because of my age.
Because that would be carelessness.
Exactly. So we need to be observant of where we are going, what we are doing, and how it's impacting us. If it's unhealthy, we have to make corrections. A lot of people involved in development of AI are speaking up regarding the limitations that we need to consider, how much we integrate that, and how do we monitor it? Like, there needs to be a monitoring body. As, yes, we want to learn. Yes, we will make mistakes, of course, but we don't want to make detrimental mistakes. So I'm not proponent of worrying, but I'm saying we should also pay attention what we are doing, how far we are integrating. Obviously, we are integrating AI into our lives. Obviously, there are certain things that are, taking too much time, we can utilize it. But then at the same time, I'm a proponent of certain time, use your brain, use your cognitive abilities. Do not necessarily use your GPS all the time. Explore, enjoy. What happens if you go this route versus that route? Playfulness and using our own cognitive abilities. Because as you know, APA published an article that because of the use of technology, we are losing our cognitive abilities. We do not memorize telephone numbers anymore. We don't memorize so many things. We don't do mental calculations. We always use our phones. So there are these clinical suggestions that we need to also still utilize.
Undoubtedly, yes.
Right? So, but then without being worried, but at the same time being concerned as what we are doing. And another, to be honest with you, one of my concern is some of the young kids that they come for assessment and we do therapy. A lot of people these days feel and they think they are on the spectrum as autism spectrum. And unfortunately, I think we have to redefine our definition of autism, because a lot of kids these days don't have friends, they don't hang out, they don't like touch, they don't like being around other people, they don't like social settings, but they are not autistic.
And they could be some of the criteria for autism.
Right? But they're not really autistic, but then they think, am I autistic? Because in the way that DSM defined autism, a lot of these are being considered. But what it is that the society, the way that kids are hanging out and connecting is more through texting. They don't even like talking. Therapy, even Yalom, I'm sure you know, that was joking and said, I start working with a group of, hospitals. They asked me to do texting. And he said, for an old school therapist, I was against it. But then I said, if it works for kids. So, I mean, where are we going? Are we doing enough to stay in touch with each other? Or are we going too far off into technology, and that is creating a gap between us?
Unfortunately, that's where you're right about your assessment and the way that we are headed toward future. In terms of, are we doing enough? I don't think we are doing enough.
We should do more.
Yes. But is it up to the individual? Yes, to some extent. But isn't it up to the society, the structures that support the county resources, all the little things that go into whether somebody can do that or not, can succeed in something or not? And so a kid needs proper counseling and understanding, and help them realize what's holding them back from the life that they can create for themselves. And unfortunately, they're not getting that. And I think partly there's parental responsibility or irresponsibility, perhaps, where if the father is also going to the cell phone at the end of a long day, well, he's also promoting that by modeling. Basic human learning behavior happens through that modeling. And so the teenager also does the same thing. So we are not doing enough. But how to correct it, I think it requires budget. Because budget creates entertainment, and entertainment is what attracts teenagers. And the attraction to the entertainment and the entertaining aspect of it is, I think, is our chance of meeting our teenagers where they are, which is sort of like the Dopamine Nation book type of analogy, where the constant gratification and lack of delay gratification and the impulse control issue that gets accounted for when we meet them where they are by showing them the right kind of education that is also entertaining. Like this movie, Inside Out, you saw that?
Yeah.
I love animation. And how they are personifying these characters. They were consultants from Internal Family Systems Institute for that movie. So we have that kind of collaboration that takes place, and it's entertaining, and kids love it. And there's opportunity for them to engage themselves in and create a career possibly out of it themselves. So they need a lot of help. And you're right, we advanced way faster than our consciousness had opportunity to catch up. And I'm still an optimist. I think we are going to reach that threshold where we are going to come close to each other, and then we are going to go forward. But there is always a chance that we are taken over by AI.
Yeah.
There's always that chance. But
I like your optimism.
Thank you. Until we get there, I think we need to be, going back to your point, concerned.
Yeah.
Worrying doesn't serve anyone.
No, but being observant, being concerned, and maybe part of it is, and I'm sure it's about the stages age-wise. And I feel like that, okay, I was young, I enjoyed, I was involved, good. Now I've reached to an age that, you know what, it's my responsibility to pay attention to what is happening to my family, to my community, where I am sitting right now. I have certain responsibilities that comes with age. I don't want my 6-year-old kid in the community to be concerned. Let him have fun. Let him be 6-year-old, 18-year-old being 18-year-old, 20s, 30s. But gradually when you get to my age and responsibility, it's more like that, okay, now I am at that age that I'm responsible to be observant for my community, and if there is anything I can do based on my life experiences, to be available. But I'm sharing this with you, and I think this is something that, each of us at different psychosocial stages as we go through, we have different tasks that we are dealing with. And I think maybe what I'm saying that is more like aligned with my age versus, where you are, you should be. You're more into the generativity stage, and you need to be. You need to be more optimist. You need to be more generative. Otherwise, nothing's going to happen. And I'm being more pushed more to the side to be more observant, giving more room for your generation to create more, while I'm also standing and observing, and hopefully if there is any help I can do, I try to step in. But I think both of us are where we should be based on our age and our, core psychological functioning.
And I love how you are doing that. You're really excelling at the dance of where your psycho-developmental stage is. You're really creating that work. I admire that about you. And I appreciate the distinction between ages, because I think that's one of the reasons I love adult mental health. That's where you get to have maximum access to one's potentials. It's ripe and ready, especially when you consider the age from, let's say, 25, 30 to 45, 55, 60. That age range is packed with potential.
Absolutely.
And there's such a desire for being coached, I think, for our younger generation. But it's just that they don't know how to ask for help. Have you noticed that? It's like
you're right.
They're cold about. There's this coldness about, and the flat affect, sort of like that makes it difficult to read how this person is feeling, how this 25-year-old man, girl, they feels, and that makes the adult, the older, especially the parent, try to guess, not trying to walk on eggshells. But if I say something, and I think that's a disservice to our younger generation, because we don't know what's inside, and there's this richness in their quietness.
Yes.
But it requires that artistry to draw them in. And I think us as older adults, sometimes we are fixated and fixed. We lose our flexibility.
Yeah, for sure.
And that's okay. That's, I'm willing to settle for a good foundation of it, and then settle in and never grow from there. But until there, it's on us to maximize our own growth. And that's one of the reasons I never liked family therapy. I love to work individually with family members, but not family therapy, because they each require a different language, right?
Yeah. No, I'm with you on that. It's very helpful. And I think there is one good thing about us as being a family in Astana, that we are coming from different age groups, and each one of us are, providing what is needed. And I think that's what makes it like a multi-layered approach, that each one is connecting to the different groups, and each one of us are maybe in that psychodrama way are playing our parts to make this work. And we are very fortunate to have you and your lovely wife on board for the Astana, and what we're doing, trying to promote this community, the place, to have people to get together, right? Providing things that we feel like is necessary.
Oh, absolutely. We lost village. And when we lost the village, we came to cities. And in the cities, we became associated with different groups. But then we lost the main connection that fosters intimacy. And what you are doing, and what similar programs out there in this county or others are doing, is trying to bridge that gap from isolation to communal gatherings, from introversion to meaningful extroversion and connection, and to create things together. And that is a great healing opportunity. And I admire us for being holding a space for that possibility, because it's hard. Again, there are budget issues, there are all kinds of limitations. The professionals are busy, they have busy lives, and when they carve out time from their busy practices to come to create communal gatherings, I think it's good for the community to do the same and participate and attend and create and foster and tell the town about it and create more opportunities, because it's not about here where they come. It's about many other locations that need to simultaneously attract people for different kind of communal gatherings and ceremonies. And that's where the good healing takes place. And thank you for that.
I absolutely admire your view, admire your work, and I feel like that we've been blessed to have you here. Thank you so much for whatever you're doing for the community, for us, and for being here today. I really appreciate it.
It's been so much fun. It's great. Let's play more and create more.
Absolutely. So hopefully we get to see you here more.
I'm gonna happen. I'm gonna make it happen.
Absolutely. Thank you very much. I really appreciate it.
Thank you. Good to be here with you.